As you may have seen on recent newscasts and articles in the media, the Zika virus is spreading throughout the world. In fact, the World Health Organization recently declared the Zika virus an international public health emergency.
As of now, the outbreaks in the Western Hemisphere have been confined primarily to Mexico, Central and South America, but cases have been reported in travelers returning from areas where the disease is prevalent.
Zika virus is transmitted to people primarily through the bite of an infected Aedes aegypti or Aedes albopictus mosquito. These mosquitoes are not native to California, but they have been detected in several California counties, including Alameda County. In May of 2015, 2 adult Aedes aegypti mosquitoes were found in the city of Hayward. No eggs, larvae, or adults have been found since then, and surveillance for these invasive Aedes mosquitoes is ongoing. Aedes aegypti and Aedes albopictus are small, black and white mosquitoes, and they tend to bite people in the daytime. They can breed in as little as a bottle cap of water, both indoors and outdoors near people. Invasive Aedes mosquitoes can only transmit Zika virus after they bite a person who has the virus in their blood. The infected mosquitoes can then spread the virus by biting other people. Since all mosquitoes require standing water to breed, we ask that you check your yard and dump and drain any containers holding water.
Some 80% of people infected with the Zika virus don't even feel sick. The most common symptoms are fever, rash, joint pain, or red eyes, known as conjunctivitis. The illness is usually mild, and symptoms can last from several days to a week. You should see your healthcare provider if you have visited an area of the world where Zika is found and you develop these symptoms. There are no vaccines or medications currently available to prevent or treat Zika infections. The best way to treat the symptoms is to get plenty of rest, drink fluids to prevent dehydration, take medicines such as acetaminophen to relieve fever and pain. Don't take aspirin or other non-steroidal anti-inflammatory drugs like ibuprofen and naproxen until dengue virus infection is ruled out. Zika virus infection during pregnancy is a cause of microcephaly and other severe fetal brain defects and has been linked to problems in infants, including eye defects, hearing loss, and impaired growth. Zika virus can be passed from males to their sexual partners. The virus is present in semen longer than in blood. Scientists are studying the full range of other potential health problems that Zika virus infection during pregnancy may cause. Pregnant women and their male partners who have visited areas where Zika virus is present should consult their healthcare providers to discuss if the woman should get a blood test for Zika virus infection.
Remember that the mosquitoes that spread the Zika virus bite mostly during the daytime. Here are some preventative measures to take. Wear long-sleeve shirts and long pants. Stay in places with air conditioning or that provide window screens to keep mosquitoes out. Sleep under a mosquito bed net if you're otherwise unable to protect yourself from mosquito bites. Use only EPA-registered insect repellents. Always follow product label instructions. Reapply insect repellent as directed. Do not spray on the skin under clothing. If using sunscreen, apply it before applying insect repellent. Treat clothing and gear with permethrin or purchase permethrin-treated items.
Although the risk is low for anyone who has not traveled to the areas identified with active Zika virus transmission, it's best to stay vigilant and responsible, especially if you or your partner are pregnant or planning to get pregnant. Remember, the virus can spread if an infected Aedes mosquito were to bite you. As of now, these invasive Aedes mosquitoes have only been found in a dozen California counties. Therefore, for most of us, the chance of contracting Zika virus is remote.
For more information about Zika virus, visit Centers for Disease Control and Prevention website, the California Department of Public Health website, or the Alameda County Mosquito Abatement website.